If you think the pandemic is slowing down, think again. On Thursday, the World Health Organization reported a record single-day increase of global COVID-19 cases. The total number of infections increased by, get this, more than 338,000 in just 24 hours. The surge led by Europe. That continent reported more than 96,000 cases on Thursday. That is more than India, Brazil, or the United States. So with more on this concerning trend, we're joined now by our Europe Bureau Chief, Crystal Gamansing, from her home in London. Crystal, thank you so much for joining us.
Good morning.
Let's get to the big picture, and I guess some of the hardest hit spots in Europe. What are the numbers showing?
Well, let's start right here in the UK, because yesterday's numbers, the latest numbers that we have for a 24-hour period, saw 17,540 infections in a 24-hour period. Now, that's just not a one-day thing. We've been watching these cases rise day over day over day, and it's important to note hospitalizations are also rising along with this. This is exactly what the two top scientific leaders had warned people was going to happen, because this, of course, follows on the trend of what we're seeing in France. France, the latest numbers from government officials there, 18,129 infections. Again, hospitalizations also rising, deaths also rising. Then, of course, we look to Spain. Spain is also having a huge increase in numbers. Now, numbers there are a little bit more dated. They're from Wednesday, and these ones are from the World Health Organization. They're saying more than 10,000 cases. So we are seeing a steep rise in infections. We know that people have some restrictions. There are different restrictions all over Europe right now. However, they don't seem to be having the effect that we saw with those massive sweeping lockdowns. But of course, there's the debate between, the harms to people's lives, to jobs, to economies, and then of course the harms when, you don't do anything, and results in more infections, more hospitalizations, and more deaths. So we are seeing a huge surge right across Europe, and there is a big challenge right now trying to figure out for governments what to do, how to balance the economy, and of course people's lives. And we do have a number of health experts who will say when it comes to public health, it's not lives versus the economy, it's lives versus lives.
Yeah, I mean, so many layers to this complex story. And speaking of London, the last time we spoke, they were just implementing new restrictions there. But it doesn't seem to have made that much of a difference. And is it possible that even more restrictions could come into effect very soon?
This is the great debate, and there is so much discussion happening. Yeah, we do have some new restrictions. There was the reduction of the group of 6. You could only meet 6 people outside when you go out, no more than that. That's that social bubble that we often talk about. Pubs, bars, and restaurants were told, okay, you can't serve past 10 o'clock. That, of course, was thought to be in line with the idea of, well, when you mix alcohol and groups of people, you start to relax on those cues that we've all been taught about keeping your distance, wearing masks, and washing hands. So they're not having the necessary effect, especially in the north and in the east of England specifically, where their restrictions are a little bit more intense. We did see the Labour Party challenging Boris Johnson and his Conservative government, saying in 19 of the 20 locations with restrictions in place, numbers are actually going up. And so we have seen a continuous rise, even in locations with these relatively minor restrictions, though that is being argued by a lot of lobby groups in the hospitality sector saying, no, these are not minor, these are major restrictions, but not necessarily having the desired impact, that's for sure.
Difficult question to answer, perhaps, but how big of a factor is travel between these countries? And is there any way to curtail that if that is seen as the major source of infection?
Travel is an issue, and it's more of an issue what we're seeing between countries themselves. Spain is a really interesting example right now because, of course, Spain is seeing the cases rise. The national government put in restrictions in Madrid and 9 surrounding municipalities around the capital. And that was actually challenged in court by the regional government, saying no, that those restrictions weren't, based in any kind of legal rationale, and they violated fundamental rights. And the court actually upheld that challenge. So right now in Spain, you have this complete chaotic situation where the national government is trying to figure out what to do. The regional government is saying, no, we don't like your measures. Of course, if the national government puts in an emergency system, they can then impose those restrictions like we saw back in March. But right now it is very much a situation where not all of these measures are welcomed, especially when it comes to travel, comes to restrictions around, the economy, bars, pubs, that sort of thing. So Madrid is an interesting example where you now have infighting from national governments to regional governments. We're seeing some of that fighting play out here. But now you have this very confusing situation in Madrid where it's going to be a long weekend. People don't know, can I leave? Can I not leave? We can say for sure right now that it looks like those fines that were being handed out in Madrid, those won't stand up because of this court challenge.
Now, you look at the situation, it looks like a different approach in every country. Is there an example of a European country which is doing it correctly?
I think a lot of people bring up New Zealand, but here in Europe, the place that a lot of leaders and public health officials, frankly, have told me about is Germany. Germany is a location where they're the dead of the middle of it, but they're continuing to do a good job holding infection rates. They have buy-in from the community, and across the board, people seem to think that Angela Merkel is leading her people and doing well when it comes to these infections.
But it's interesting, even the countries like Ireland, for example, which saw, applauded in many ways, they're seeing a spike in numbers. So it's really difficult to get a hold of this. Of course, we will follow this closely. Crystal, as always, thank you so much for joining us. Our Europe Bureau Chief, Crystal Gamansing.